talk about the neurotransmitters of the autonomic nervous system. The autonomic nervous system uses both acetylcholine and norepinephrine. And the confusing part is that either neurotransmitter can cause stimulation or inhibition depending on which organ it's on. Cells that release acetylcholine are called cholinergic neurons, and the acetylcholine is picked up by target cells called cholinergic receptors. Cells that release norepinephrine are called adrenergic neurons, and the receptors are also called adrenergic. Let's look at a comparison of the two systems. Here we have the parasympathetic system. Remember, the preganglionic axon of the parasympathetic system is very, very long, with the postganglionic axon being fairly short. In the sympathetic system, our preganglionic axons were fairly short, with the postganglionic axons fairly long. Now, the nice thing is that in both the parasympathetic system and the sympathetic system, our preganglionic neurotransmitter is always acetylcholine. Where we differ is in the postganglionic neurotransmitter. In the parasympathetic system, our postganglionic neurotransmitter is also acetylcholine. So far we have acetylcholine in all of our somatic neurons. We've used it in all of our preganglionic, parasympathetic, and sympathetic pathways, and we've also used it in our postganglionic parasympathetic neurons. The change is that we're going to use norepinephrine as our postganglionic neurotransmitter for the sympathetic system. When we look at cholinergic receptors, the ones that are able to receive acetylcholine, there's two main categories. They're named for chemicals that will also stimulate the receptors. So we have nicotinic receptors, which respond to nicotine, and muscarinic receptors, which also respond to muscarine. The nicotinic receptors are found on all the ganglionic neurons and cells of the adrenal medulla. When acetylcholine binds to the nicotinic receptor, it's going to open a cation channel. Sodium will move into the cell, and the cell will start to depolarize. Muscarinic receptors are found on all target organs of the parasympathetic division and a few of the sympathetic division. All muscarinic receptors are going to use secondary messenger systems on membranes, but the different subtypes are going to have different effects. For example, when acetylcholine binds to muscarinic receptors on the smooth muscle of the GI tract, it's actually going to stimulate the muscle to contract more. In other words, it's going to encourage depolarization. When acetylcholine binds to muscarinic receptors on cardiac muscle, heart rate decreases. So in this case, acetylcholine is actually going to cause a hyperpolarization on the membrane. Norepinephrine is a catecholamine, and we break the receptors down into alpha and beta receptors. Alpha receptors are typically stimulated by norepinephrine, whereas beta receptors can be stimulated or inhibited by norepinephrine. Alpha receptors are found on most smooth muscle. They're located in blood vessels. They cause vasoconstriction, in the erector pili muscles of the skin. The alpha-2 receptors are located throughout the central nervous system and in the pancreas and part of the GI tract. The beta receptors are interesting. The beta-1 receptors are primarily stimulatory. These are located in the heart and in the kidneys. The beta-2 receptors are primarily inhibitory, and these can also be found in the lungs. One heart, two lungs. So beta-1 on the heart, beta-2 on the lungs. So epinephrine can be used to treat asthma. What happens is asthma attacks will narrow the bronchioles. So the bronchioles are small airways or air passages inside of the lungs surrounded by smooth muscle. That muscle contains beta-2 adrenergic receptors. The beta-2 receptors in this case are going to be inhibitory. So as epinephrine binds to the beta-2 receptors, it's going to stop the smooth muscle from contracting, which is going to relax the muscle and actually open the airways to make breathing easier. So this idea that every organ, or nearly every organ system in the body, has both parasympathetic and sympathetic input is called dual innervation. That dual innervation leads to antagonistic effects or dynamic antagonism. So commonly the two divisions oppose each other, kind of like the gas and the brake in a car. One is telling a certain organ to go faster, the other system would be telling that same organ to go slower. So we look at things like control of heart rate. Parasympathetic activity is going to slow heart rate, sympathetic activity will speed it up. Cardiac cells, therefore, are going to have both cholinergic and adrenergic receptors. Parasympathetic activity tends to increase GI motility. Sympathetic activation tends to decrease GI motility. So therefore, GI smooth muscle has both types of receptors. The pupil of the eye also exhibits dynamic antagonism. Sympathetic innervation causes the pupil to dilate, whereas parasympathetic innervation causes it to constrict. This dual innervation does have some cooperative effects where the parasympathetic and the sympathetic stimulation both contribute to an overall response. For example, male sexual function is governed by dual innervation, where erection is due to parasympathetic activity and ejaculation is due to sympathetic activity. Now, there are a few systems that are only controlled by one half of the autonomic system. These are controlled by the sympathetic nervous system. So, for example, blood vessels will constrict with increased sympathetic activity, and they will dilate with decreased sympathetic activity. So instead of the accelerator and brake in your car, this is more of just taking your foot off of the accelerator, with the car slowing down, but more slowly than it would if you had applied your foot to the brake. So some examples of effectors that are only innervated by the sympathetic division. We've got sweat glands in the trunk, the erector pilae muscles of the skin, and the adrenal medulla. So let's look at a clinical example. Raynaud's syndrome is a sudden constriction of small arteries of the digits. This causes the fingers to turn white as blood is cut off from them. That's accompanied by pain. This can be triggered by cold or emotional stress or smoking, and it's a lot more common in females than in males. And then as blood flows continues to be restricted, the fingers start to turn blue, and then this is followed by relaxation of the smooth muscles of the bloodstream, and then the fingers will turn red. Remember you were camping, cooking some eggs, eating some bacon, drinking some OJ, and here comes a bear. What happens? Your heart starts racing, you start breathing fast, your pupils get really big to look and see a way to get away from the bear. Your blood vessels start to constrict, forcing more blood to your muscles so that you can run away from the bear. Your skin starts to sweat so that you can stay relatively cool as you run away from the bear so you don't overheat and pass out and become a bear snack. What about all that bacon that you were eating? Do you really need to digest it like right now? Or can you put that off for a little while? So the digestive system starts to slow down. The digestive system includes the mouth, the stomach, the intestines. So everything slows way down. Heart rate sped up, lungs sped up, you're sweating, your pupils are really big, and you're also going to move a lot of blood away from your skin in case the bear claws at you. You don't want to bleed to death. So all of these things combined are a sympathetic response. And it should sound kind of familiar. Have you ever had your heart pounding, you're breathing fast, your hands are cold and pale and sweaty? That's all part of a sympathetic response. So why is this all going on? Well, for the simple reason that we engage the sympathetic autonomic nervous system, we're going to use norepinephrine as our postganglionic neurotransmitter. So if I ask and say, what kind of effect does norepinephrine have on cardiac muscle tissue? That sounds a little confusing, but walk through the bear story for a second. We know that norepinephrine is part of the sympathetic response and that the heart speeds up during a sympathetic response. And so your answer should be that norepinephrine is going to have a stimulatory effect on cardiac muscle tissue. What about the smooth muscle of the lungs? It's actually going to be inhibitory. Remember, the bronchioles of the lungs need to open up so that you can get more air into your lungs as you're running away from the bear. What's it going to do to smooth muscles of the blood vessels going to the intestines? Well, it's going to cause them to constrict. As they constrict, they're going to allow less blood to flow into those organs, and so those organs are going to slow down because you can worry about digesting your bacon later. What will the sympathetic system do to blood pressure? The heart's beating faster, it's pumping more blood every time it beats, and it's pumping it into a smaller region. We've moved all the blood away from the internal organs and away from the skin and put it all into the muscles, and so blood pressure in the muscles is going to rise astronomically. So this is a really easy way to kind of process the entire autonomic system. Let's just think about a sympathetic response. We know that we're using norepinephrine, we know we're using the sympathetic chain ganglia, and it's coming from the thoracolumbar region. The parasympathetic system is just the opposite. Have you ever had a food coma after Thanksgiving? Say you ate that really big breakfast of bacon and eggs while camping, and you lay down in your hammock to take a nap. Do your pupils need to be very big to see what's going on when you're staring at the inside of your eyelids? No. So the pupils are going to constrict. You're not being active, so you don't really need to sweat, so your sweat glands are going to calm down. Heart rate will slow down, respiration will slow down, GI motility will increase dramatically. You've got to digest all that bacon and OJ that you've been eating. What about when you're asleep? What kind of autonomic system should you be in? Parasympathetic. Can you imagine trying to sleep if you were just jazzed up as you would be if a bear was chasing you? It would be impossible. Also, that is why sexual arousal occurs during the parasympathetic system response. Running away from a bear is not time to engage in any kind of hanky-panky. And since the parasympathetic response is active during sleep, and that's the time for sexual arousal, that's why a lot of males will wake up with an erection.